Hospitals across the country are seeing a spike in cases of RSV, leaving doctors scrambling to find open beds. According to Texas Health and Human Services, there are 28 pediatric ICU beds available in our region. Joining us live now is Dr. Michael Chang, pediatric infectious disease specialist with UT Health Houston and Children's Memorial Hermann Hospital. Dr. Chang, how is this virus different from the common flu? What are the symptoms?
Yeah, it's a different family of viruses, but the symptoms actually are pretty much similar to any other respiratory virus. So mostly runny nose, cough, and sore throat. And that's what the majority of kids are going to experience. But unfortunately for kids less than 2 years of age, this virus can get into the lower lungs and cause pneumonia or bronchiolitis, which is inflammation of kind of the small airways of the lungs. And that can cause a lot of difficulty breathing, difficulty with feeding, dehydration. And so kids under 2, and especially those under age 1 and younger, and any kids that are that age with underlying heart or lung disease can be at risk for severe illness with RSV.
And what is the current situation in your hospital system? How many pediatric ICU beds do you guys have available?
So I can't comment on specifics, but we are definitely very busy. We're seeing more RSV cases right now than even in a typical winter. And so parents of older kids may recall long waits for urgent cares and emergency departments, and we're seeing that across our region. We have capacity, but we are definitely very busy with RSV and also the flu. And so, I think if parents start to notice problems, we'll definitely find space for you and we'll take care of you. But at the same time, be prepared for long waits at the urgent care and emergency rooms.
So what can parents do? Is there a vaccine available?
So unfortunately, there's no vaccine available. Actually, the ACIP just discussed some vaccine candidates that seem promising, but as of right now, there's no vaccine available. Now, what's interesting about RSV is that it is definitely spread by those droplets and by contact that we've talked about with, previously during this pandemic. And it's actually well controlled by the infection prevention measures like good hygiene, physical distancing, wearing a mask. And so, for parents of younger kids, number one, avoid crowded indoor spaces, avoid other sick kids, practice really good hygiene, and then just look out for those symptoms, that trouble breathing. If you have a young baby, difficulty with breastfeeding or bottle feeding, shortness of breath, and if you're worried about them getting dehydrated, seek medical care.
Thank you so much, Dr. Michael Chang with UT Health Houston. Thanks for joining us.